Hello, this is Dr. Gay from First Look MRI, and this is a 70-year-old male who fell about 3 weeks ago, has had continued shoulder pain since the fall, and went to his orthopedic surgeon, and they got this MRI. So the MRI shows a tear of the supraspinatus tendon, bread and butter thing we see all the time. This is the supraspinatus muscle. This is the central tendon, comes across, and this is the end of it. This is the humeral head. This is about the 12 o'clock position here at the top. And it should attach over here, but instead it's torn from the attachment over here on the greater tuberosity footprint and retracted back over here. Now the tear not only involves the supraspinatus, but if we roll forward, there's another component of the rotator cuff here. This is the subscapularis. We can see that better on the axial view like this. On the axial view we see the rotator cuff in back, and we see the rotator cuff in front, the subscapularis here in front. On this coronal view, we see the rotator cuff over the top, the supraspinatus, and then the infraspinatus. And now the subscapularis tendon is right here. This is the muscle, this intermediate signal intensity area. That dark band is the central tendon. Here's the tendon, and here's about the end of it. Normally the tendon will attach right over here on this lesser tuberosity, and this is the end of it. There's something right here in the way. This is the biceps tendon that's in an abnormal position. So if we roll up to the top, this is where the biceps tendon originates, the top here of the glenoid, and normally it'll shoot straight across like this and go into this bicipital groove. There's a little cup here, and it'll go down here, but instead we see the biceps tendon over here. And so when the subscapularis tendon tears, the biceps tendon can slip out of the normal position and dislocate and course down here along the anterior shoulder, and eventually it goes back to normal position down here in the arm. But this is an intact biceps tendon, but it's dislocated medially, and again it goes into this torn, retracted subscapularis tear. So really common thing when you have a ruptured subscapularis tendon to also have a dislocated biceps tendon. Now the subscapularis attaches here on the lesser tuberosity, but there's also a component that goes over the top of the bicipital groove, the transverse ligament we call it, and it holds that biceps tendon into place. But again, when it tears and that transverse ligament component tears, then again the biceps tendon can slip and dislocate like this. So a massive tear involving the supraspinatus and subscapularis tendons and a dislocated biceps tendon. Thank you very much.